Many people have healthcare workers in the family who are helping fight the coronavirus, but we found one family where one, two, three, four sisters, all four of them are nurses, right there on the front lines. There's Kimberly and Ashley. They work in the same Virginia hospital. Then there's Gina. She works in a Maryland emergency room. And last but not least, there's Courtney. She works in an ICU. That's one in California. Our national correspondent, Jericka Duncan, spoke to all of them about why they wanted to become nurses in the first place.
And it's so much fun to share that with all my sisters.
Friends still call them the Carroll Girls. They span an age from 46 to 29 and live in different parts of the country. Their father served in the U.S. Army and their mother works in a high school. While these sisters may have different last names now, they're united in their commitment to others.
How much do you think your background and you all being sisters and all going into the same field play in how you care for others?
I'm one of 5 nurses, 5 girls, and I treat my patients like I would if it were my parents in that bed or if it were my sisters.
I think looking into your patient's eyes and trying to convey a level of safety is the most important thing that we can do, because it was conveyed to us with the loss of our sister in a very sudden way.
In 2008, their sister Tina, Gina's identical twin, passed away suddenly from a heart condition. She was also a pediatric nurse.
And I saw us all come together, specifically my older sisters, and how strong they were for all of us. I associated it all with being a nurse. You know, I thought it was our superpower. People, they compare it to like superheroes now in the pandemic, but it's something I've always felt in our little Carroll girl family is we can take on anything.
Do you feel even more valued today than you ever have in your careers?
People are regarding us in the same light as military war heroes. And there's times where I step back and I'm like, wait, it's not like that. But then I go, but I guess we are fighting a war.
Early on in this pandemic, I'm sure you saw the videos of nurses breaking down, doctors breaking down. Was there ever a moment where you felt or questioned, should I be doing this right now?
If someone says they're not scared, they're lying, because you're scared, but you never doubt not doing your job.
What advice do you have to those nurses out there?
The biggest advice I have for people is to talk. We are so used to taking care of people that we bottle everything up. If my family has taught me anything, it is in times of crisis, you have to get things out. And once you do that, it almost transforms you into a different person. You're able to care for yourself, your family, and other people.
That was Jericka Duncan reporting the last time that the Carroll sisters were all physically together was last Christmas. But guess what? They plan to reunite in August, as they do every year, on the anniversary of their sister Tina's death, even if that means wearing a mask and gloves and keeping their distance. I do think, Anthony, they've got great superpowers, and I can only think about Tina, how proud she must be watching all her sisters carry on. What a great story, Jericka.